Starting with the next part, and that is the superficial and the subcutaneous mycosis. I hope by now all of you are aware and you've done your introductory portion well. Superficial had everything that was to do with tinea versicolor, the different types of tinea as well as the dermatophytes. So that is exactly what we are starting with first. And after that, the subcutaneous mycosis had the very famous mnemonic, that is MRCS. So the entire target of this section is going to be this. So starting first with, as I said, tinea versicolor. And what is the other thing about tinea versicolor that all of us should be knowing? The name of the organism, and that is Malassezia furfur. So yes, Malassezia furfur. There are other species of Malassezia also which might be there, but most importantly you have to know furfur only. And if I ask you from dermatology point of view, how does this tinea versicolor present? In some of the books it is also written as pityriasis versicolor. So that also stands for the same thing. And if you look at it under the the clinical spectrum, you can zoom into this picture and have a look at this. On the back, you will easily visualize that the patient is having these hypopigmented lesions, right? So on the back, on the trunk, hypopigmented lesions are there. Scales may be present which are not very readily visible. So the most important part that you have to know is that there are going to be hypopigmented lesions, and very commonly they are seen on the trunk or they are seen on the back. So these are common sites. And under wood lamp, so I hope you all remember in dermatology, for everything we do a wood lamp examination. So under wood lamp examination means using a UV light. Wood lamp examination is done using a UV light and we get to see a yellow fluorescence. There is a yellow fluorescence that is noted. And how have I learned it? Is because now that we are talking about something yellow in dermatology, let's think of a yellow color fruit that we have, and that can be our microbiology. So what is the yellow color fruit? So what you do, that you're going to take skin scrapings to make the diagnosis. I'm going to take skin scrapings, and from these scrapings I'm going to look at it under which mount is this. I've not added any color. Which mount is it? This is the very, very famous KOH mount. So remember I told you we'll use a 10 to 20% of KOH mount, and as soon as I saw KOH mount, before I start with that, where have you read tinea versicolor or Malassezia furfur? Which part of your classification was it there? Is it yeast? Is it yeast-like? So I hope you all remember that Malassezia furfur was a yeast-like organism. Whenever I say something is a yeast-like organism, means it's going to have budding form also, and it is going to have the pseudo hyphae also. And if you remember this information, now let me go on to it. When I say budding, means there is going to be a bunch of something that is budding. So if we draw it out again, there's going to be a bunch of something that is going to be budding. Isn't it looking like grapes? So these are all the buds. And then we have something which is going lengthy like this, and these are going to be the pseudo hyphae. So this is looking like a banana. So can I call it the banana and grapes appearance if you're vegetarian? But if you're non-vegetarian, then to the buds, you're going to call the buds as the meatball. You're going to call it as the meatball, and these are going to be the budding form of it. And all the lengthy one, you're going to call it as spaghetti pasta. So many food items that I have ruined for all of you. So now let's look at it. So first and foremost, this is known as the spaghetti and meatball appearance. This is known as the spaghetti and meatball appearance. If you're vegetarian, this is known as the banana and grapes appearance. So have a look at this picture. Firstly, it's a KOH mount because it doesn't have any color. If you zoom into it, you can see those lengthy pseudo hyphae, the lengthy structures. Yes, so that becomes the spaghetti pasta. And you can also see that bunch of buds, that is the meatball. So that is why you called it spaghetti and meatball. There's another meatball down here. So spaghetti and meatball appearance, or banana and grapes appearance. Okay, there's not the end. There's one more food item that I'm going to ruin for you, and that is when you look at it under culture. When you want to culture it, I think everyone knows by now that the culture that we'll be using everywhere is going to be the SDA, Subaurous dextrosagar. But there's something different about Malassezia. Malassezia is a lipophilic organism. If you try to grow it in a regular SDA, you won't be able to grow it. You will have to add something. Olive oil. Why did I say olive oil? Because olive oil is fatty, lipo, so it will need that fatty source. Only then it is going to grow. Okay. So remember, when you have SDA with olive oil, with oil obviously you will fry something. So what you get is the very famous fried egg colonies. We get the presence of fried egg colonies. You can see over here, we can zoom in once again and find out these are the different fried egg colonies that you have. They look exactly like the way you fry a sunny side up or a fried egg that you see over here. So well, having said that, now I think everyone knows that if I'm dealing with a colony, I might want to pick up that colony and I might want to look at it under the microscope. What did I teach you? What do we use for culture morphology? What stain is used? So for culture morphology, the stain used is lactophenol cotton blue. And lactophenol cotton blue is showing you the same spaghetti and meatball. See, the lengthy ones are the spaghetti and the round one clusters are going to be the meatball. So every kind of stain that you may put, the appearance will always be the same. Whether you put a KOH mount or you put an LPCB, you will always get a spaghetti and meatball appearance. So now, having said that, before I summarize this entire thing, so which are the other places that you see the very famous spaghetti and meatball appearance? Where do we see the spaghetti and meatball appearance? And that is going to be first place, which I've just taught you right now, that is Malassezia furfur. And the second one is a pap smear finding that you have studied in pathology. If you remember very well, there was a condition called trichomonas and leptothrix. There was a condition called trichomonas and leptothrix. So remember, trichomonas over there was looking like the meatball and leptothrix was looking over there like the spaghetti pasta. So if you remembered it, very good. If not, it's time to revisit the pathology lectures. So that was the first correlation. What other do you need to correlate? There is also something referred to as so many fried egg appearances that you have both in path and micro. So where all do you get to see the different fried egg appearances? Please remember, let's divide it chapter wise or rather subject wise. When I'm talking about microbiology, which we are studying right now, there are 2 M colonies which are fried egg. The first one we've done right now, that is Malassezia furfur, and I hope you also remember your bacteriology section where mycoplasma colonies are also fried egg. The second one, let's talk about what all did you study in pathology. So when we talk about pathology, is there any brain tumor? I think you all remember I gave you a method also of learning, that is the brain tumor with all the O's, oligodendroglioma. Oligodendroglioma, that is going to have the eggs in it. Then when we came down to discussing the testicular and the ovarian tumors, we had studied that seminoma, and obviously that's in the testis. The same thing that we talk about in the ovary is going to be dysgerminoma. So all these ones are also going to have, and also one very important thing, bone marrow biopsy of hairy cell leukemia. Remember, again, I had taught you bone marrow biopsy. So yes, these are all the fried egg appearances that are going to help you. Let's do a very quick recap. For microbiology, we have the 2 M colonies, that is Malassezia furfur and mycoplasma. For pathology, brain tumor, oligodendroglioma, testicular and ovarian tumor, seminoma, dysgerminoma, and on a bone marrow biopsy of hairy cell leukemia. Coming back, now it's time for us to, like I said, after every bacteria, virus, protozoa and fungus, we summarize things. So here you have in front of you the classical summary of Malassezia furfur. What do you need to know? Point number 1, what kind of lesions? We have the very famous hypopigmented lesions. Next, what are you going to see under the microscope? We'll see the, again, very famous, lot of food items coming. So spaghetti and meatball appearance. And if we are vegetarian, then we call it as the banana and grapes appearance. Coming to the next one, we see what kind of colonies? We see the very famous fried egg colonies. If I want to fry the eggs, I need oil, right? So I can't put a regular SDA, I will need a regular SDA with a little bit of olive oil so that I can fry the eggs. That's the entire summary that you have for Malassezia furfur. So this was the first part. After this, which was the other superficial infection that I told you we'll be discussing. Before that, also one more thing that I want to tell you, since we're discussing all the fungal organisms, we'll alongside also talk about their treatments. So when I'm talking about Tinea versicolor, you have a topical treatment and a systemic treatment. So for topical treatment, there are a couple of ointments available, sulfur ointments, or there are imidazole creams that are available. And for systemic, you have the azoles, that is, we have itraconazole, fluconazole. So usually one or both of them are given as a combination of topical treatments and systemic therapy. Well, having discussed this, now before I go on to the other, the main dermatophytes, there are quick other tenias that I want to discuss. There is one tenia which is known as tenia nigra. So what we discussed up till now was tenia versicolor. Now I come to tenia nigra. As soon as I use the word nigra, there is going to be some element of brown or black that is going to come up in front of you. Niger word, na? And look at these three pictures. Beautiful. I don't need any description further. Niger word means something brown, black. So look at the picture that you have of a lesion on the palm. Look at the picture of a lesion that you have on the soles. And when you decided to do a KOH mount, see, I always told you KOH was what? KOH was no color. It was just a chemical, right? But suddenly, even with KOH, you are seeing, you're not supposed to see a color, but you're still seeing the brown color. Why? Because the fungus itself has a brown color. So whether it occurs on the palms or the soles, or whether you see it under microscope, the brown color is always going to be there. And the organism that we are talking about is Horte wernicki. So now there's a trick that I'm going to tell you for fungal organisms. Where all will you get this brownish, blackish color? So see, whenever you heat something, if you overheat a pizza or any food item, everything starts becoming black or brown. So wherever the word Horte or wherever the word hot will come, something black is going to come. So like over here, you say Horte wernicki. So Horte wernicki causes something hot means black. So some black is going to occur. That is why we are talking about tenia nigra. Also, please remember Horte is halophilic. When I say halophilic, it is going to be something that is salt loving. That is why it is seen in the fishermen. Fishermen, the salty water, the salty sand. So remember, it is halophilic. That is why it is seen in the fishermen. And for treatment, we have the imidazole topical creams that are available, that are put on where? The palms and the soles. Whatever I have shown you is the thing. Means the most common location is going to be the palms and the soles. Okay, now having said this, moving away from the skin, now we go a little bit into the hair, and that is pedra. When I say pedra, we have two things. These are quick things that I'm revising from dermatology, right? We have something which is referred to as white pedra, and we have something called black pedra, both affecting the hair. But you can see the white pedra is going to come across as white dots, and black pedra is going to be as black dots. So which organism causes it? So please remember, white pedra is caused by Trichosporon beigeli, and black pedra is caused by Piedra horte. How do I learn this? Very simple. See, I told you as soon as anything to do with horte will come, means the color is going to become brown black. So when they say black pedra, so pedra word remains as it is, but instead of black, I can add the word horte. So Piedra horte will cause the black pedra. And Trichosporon beigeli is how you say it, but I will call it bijli. I hope everyone understands that much of Hindi, that bijli is what is going to be lighting. Right? So yes, the lighting, bijli is obviously white in color. The bijli is going to be white in color, right? So when I say bijli, I'm talking about white piedra. When I say hot, I'm going to talk about black piedra. That is something that is important. Having said that, now let's move on to what is the treatment. So if there's a hair follicle affected with black or white piedra, what do? First is cut and shave the hair. The first thing that you have to do is cut or shave the hair, and along with that, you give the same like you were giving for tenia nigra, also the same, that is topical imidazole creams are given after cutting and shaving the hair. Okay, now moving on, having discussed all these tenia, we still have a few left, because now we are going to go on to the next family, that is dermatophytosis. Dermatophytosis, also known as teniasis. Lots of tenia. So there is, how you read this, students often confuse it. Tenia is the name of a disease. Tenia is caused by many organisms, and the name of those organisms I will be teaching you now. But if I say teniasis or dermatophytosis, that's the overall spectrum name of the disease. So when I talk about teniasis, there are three organisms which are written as TME. Now remember, TME is a very famous short form. If you ever type Telegram URL is TME, right? So for Telegram you have TME. So remember, T for trichophyton, M for microsporum, and E for epidermophyton. Trichophyton, microsporum, and epidermophyton. That is what you have to know. So TME, and I'm telling you to learn it again and again in the same order, and I'll tell you why in exactly a few minutes when I tell you a mnemonic. Having said that, before I go into each one of them individually, trichophyton, microsporum, epidermophyton, some of them are found as human to human, some of them are found in the environment, some of them are found in animals. So how do I get to know? There's a very lengthy and tough classification that I'm going to show you now. So anthropophilic to do obviously with humans, zoophilic to do with animals, and geophilic to do with the geography and the environment. So how am I going to learn this? So see, when I say T, see all these T's and E's, you know, T's are all trichophytans, M's are going to be microsporums, if there's E, there's going to be epidermophytans. So basically all the T, M, E I know, but what words ahead of it? So see, Trichophyton terrestriae, Trichophyton gypsum, these are geophilic. How do I learn this? Geo reminds me of geography. What is in the geography? What is in the environment? Gypsum is in the environment. Terrestrial is also to do with the geography and the environment, nature. So terrestrial, extraterrestrial, gypsum, all these are things to do with geography, environment. So I put them under geophilic. Next, when I talk about zoophilic, zoo has to remind me of all the animals. So equinum, whether it is Trichophyton equinum or it is Microsporum equinum. Equinum reminds me of horses. So horse is going to come under the zoophilic. Then canis will remind me of dogs. That is also going to come. And verrucosum. So I have learned veru as sheru. Sheru is the usual Indian famous name given to most of the dogs and most of the pet animals. So remember the equinum, the canis, which dog? Sheru dog. So veru, sheru, verrucosum, all these are going to come under the animals. After that, whatever may be written, that is rubrum, tonsurans, schonleni, violaceum, auduni, all of these are coming under the anthropophilic. So that's the only way of learning this. I've tried so many ways otherwise, but that's the best possible way that I can come across. Repeating once again, when we are talking about, let's do a quick mnemonic. When we are talking about geography, we are talking about terrestrial and gypsum. When we are talking about the animals, then the horse, that is equinum, the dog, that is canis, and sheru dog, that is verrucosum. And after that, whatever will be left will come under the anthropophilic. Just one word. When we are talking about this Tinea rubrum, just as telling you as a side question, because you might see this in many of the, the grand tests and PYQ banks. Tinea rubrum is very famous for causing nail infection. Nail infection is very common. Nail infection is known as what? It is known as onychomycosis, right? So one of the trichophytans which is very famous for causing this nail infection is going to be Trichophyton rubrum. And if they ask you, okay, there's Trichophyton rubrum causing nail infection, what category does it come under? It comes under anthropophilic. Having discussed it, now coming back, whether it is Trichophyton or Microsporum or epidermophyton, at the end of the day, what it's going to cause is teniasis. So let me start with the clinical aspect of the disease, that is teniasis. Then I'll take you gradually into the organism. So I've got you all the infections of the head and the scalp in one side. So we've got something called Tinea capitis. When I say capitis, cap will refer to the scalp, right? So this over here is going to be a case of Tinea capitis. Capitis means cap and scalp. Okay, you can see these patches, but suddenly on these patches, if I say that there is some crust formation, you can see if you zoom in carefully, can you see in the next picture, you're seeing some crusting over here and some crusting over here. So if you start seeing crust formation, that is known as crust or scutula. That is known as crust or scutula. That is known as Tinea favus. Now remember, I have learned Tinea favus. Favus means flakes and flakes means crust. So that is how I have learnt it, that favus is the one that is going to cause all the flaky things, the crusting things known as scutula, and S for scutula or SC for scutula, SC for Schonleni. Exactly which trichophyton causes it? Trichophyton Schonleni causes it. So remember, SC for scutula, and SC for Schonleni. Coming to the next, now suddenly the scalp is going to become like a, a round swelling, a ball, ping pong ball kind of swelling. That is a carrion. Carrion is something which is defined as a boggy swelling and is an examiner's favorite. It's one of the most famous previous year questions. So, carrion can be caused by mentagrophytes, it can be caused by verrucosum. These are just few examples of how the different organisms can cause it. So, simple. When I'm talking about the scalp, let's zoom into these pictures and see. If I give you this picture, it was only occurring as a simple lesion on the scalp. It is capitis. If I end up putting a little bit of crusts and flakes into it, then I will call it what? I will call it scutula. This is going to be Tinea favus, means flakes and crusts have been put. If I convert convert it into a boggy swelling, then we are going to refer to it as a carry-on. So what you have over here is a carry-on. Okay, having said that, so I can put a tick mark to all the head related things. Now let's come to the face and the body. Let's go by common sense. If I say there is a tinea involving the face, what tinea will you call it? Tinea facie will obviously involve the face. If I say someone's beard is getting affected, so tinea barbae. Tinea barbae is what is going to be beard involvement. If I say there is a trunk involvement, trunk means, what is the meaning of the word corporis? Corporis means trunk. And if I say imbricata, imbric, concentric. So if I see concentric lesions, it is tinea imbricata. Let me show you some pictures. See, look over here. Over here, the patient's trunk is getting affected. Trunk basically refers to corporis. So, when I see the presence of tinea corporis, I will see these fungal, classical, ring-like fungal infections. These are going to be on the trunk, so that is tinea corporis. But if I make that a little concentric, can you see? There are these concentric circles. So, there's a very simple way of learning it, that when it is concentric, it is imbric. That is, it is tinea imbricata, which is going to show you concentric circles. Okay, having said that, coming to the next. So, we've done all the head related things, we've done all the face and the trunk related things. Now let's go on to a little more common sense kind of a thing. When I say tinea unguum, what is the meaning of unguum? Unguum refers to nail, right? So if there is involvement of nail bed, have a look at this picture. Like I said, unguum basically means that there's going to be involvement of the nails, and that you can very well visualize over here. Again, a common sense thing. Coming to the next one, when we talk about tinea cruris, what is the meaning of cruris? Cruris means groin. So when there is involvement of the groin, we call it tinea cruris, and this is very commonly seen in the dhobis, or it is also known as, because there is constant exposure to moist water. So there is dhobi itch, or people who tend to itch a lot, or there's closed clothes, forever they are wearing tight clothes. So jock itch, remember the jock, that is the area where the the underclothes are worn. So jock itch as well as the dhobi itch, they are all referring to the groin area. Groin area referred to as the cruris. Lastly, no points for guessing. What is tinea pedis? Pedis means pedia, means the foot is going to be affected, very commonly known as athlete's foot. So that brings you down to a summary of everything, which I'm going to quickly recall. And that I'm going to recall with what? With the help of direct photos. So quickly tell me, the first one over here was capitis, because there is involvement of the cap, scalp. If there is involvement of flakes, that is you call as tinea favis. So this means there are flakes, or there is cutula over here. Then we said there's a boggy swelling. The boggy swelling was said to be carry-on. That was famous. Then if there is involvement of the nail bed, it is known as tinea unguum. Unguum for nail bed. If there is involvement of the trunk, we refer to it as what? We refer it to as tinea corporis. And if there are any concentric lesions, so concentric was known as tinea imbric, that is imbricata, tinea imbricata. Other than that, so for feet you had pedis, for the groin you had cruris, for the face you had facie, for the beard you had barbae. These were all the names which were self-explanatory. Okay, all said and done. Out of all of these, I've only been focusing too much on obviously the skin part of it. If I go into a little bit of hair infection, which is actually a little tougher part, that is what I'll be talking about next. So if you go all the way back, guys, to the first part where I told you the introduction of the sexual and the asexual spores, over there you are going to analyze that there was something known as the arthrospores, and arthrospores were coming under the asexual spores, if you remember. And also please remember, I told you arthrospores are present in two places, coccidioidomycosis, which I'm yet to teach you, and the other one was the dermatophytes. So yes, now I'm going to talk about the dermatophytes, and please remember, you can see there's something called ectothrix and there is something called endothrix, and the name is explanatory. Now see, if these arthrospores are outside the hair shaft, if the arthrospores are outside the hair shaft, it is ectothrix. If you see the arthrospores inside the hair shaft, they are going to be endothrix. So now all that you need to know. So if you see the arthrospores outside, it is ectothrix. If you see them inside, they are going to be endothrix. Now you need to know which organisms come under what. Organisms are still the same. TME, Trichophyton, Microsporum, Epidermophyton. Organisms are still the same. Now you just need to visualize them. So what are you going to know now? See, what are the things that always roam outside? So remember, canis, dogs. Canis or dogs, they are always going to roam outside. Also Microsporum audini. Now if you buy an Audi car, if you buy an Audi car, obviously you are going to show off and roam around outside, right? So remember, for outside, for ectothrix, either you will learn about the dog, which is canis, which will always go out, or audini, that is Audi car, which is always going to be on the road for show off. Whereas if you want to roam around inside your colony, which is the best vehicle, which a lot of you will agree with me, the best vehicle to roam around in your own colony, and especially in traffic cities, that is TVS Scooty. TVS Scooty inside, if you want to roam around inside in your locality, TVS Scooty is the best. So remember, that is Trichophyton tonsurans, Trichophyton violaceum, and Trichophyton schonlini. I know it's tough, but that's the only story I could think of. So remember, when you're talking about tonsurans, violaceum, and schonlini, the TVS Scooty is going to help you roam inside, so it will show you endothrix. Whereas when you're talking about Microsporum canis and audini, so remember, the dog and Audi will be for show off outside, so that is going to be the ectothrix. Having discussed this, now let's move on and talk about the different organisms and how they are going to look under the microscope. So when I'm talking about dermatophytes, the first thing I told you was we'll be dealing with Trichophyton, Microsporum, and Epidermophyton, right? Now, before I go into how you're going to see them under the microscope, let me tell you the clinical features. So I'll take you all the way back and talk about the classification first. So this is what you had: Trichophyton, Microsporum, and Epidermophyton. All of them are under dermatophytes, which means that skin involvement is going to occur with each one of them. Skin is mandatory, that the skin infection will be there. Other than skin infection, please remember, when I say tri means all three things: skin, hair, and nails. Because there are three things in dermatology, right? Skin, hair, and nails. So in tricho, all tri will be affected. In Microsporum, it is skin and hair. And in Epidermophyton, it is skin and nails. And how will I remember? Because here the confusion will occur. So remember, Epidermophyton, the one that is ending with N, that is going to have the nails in it. So remember, Epidermophyton will have the nails and Microsporum will have the hair. So simple. When I'm talking about Trichophyton, all tri, skin, hair, nails. Microsporum, skin and hair. Epidermophyton, skin and nails. Having said that, now we come back to this mnemonic. Why did I say TME? Because now I'm going to tell you that to differentiate them, you have some big structures called macroconidia, and then there are some small structures that are referred to as microconidia. Please remember, the microconidia are arranged in a descending order, which means that in Trichophyton you have the maximum microconidia, then a little in Microsporum, and least or absent in Epidermophyton. That is how you learn the microconidia. Okay, first I'll show you a picture. So let's have a look at a picture. The first one that you have, can you see? Can you all see these tiny structures? So when you're dealing with these tiny, so many of them, this is what you're calling as microconidia, right? So how many microconidia are you seeing? I'm seeing abundant microconidia. So which organism this must be? This must be Trichophyton. This must have been Trichophyton. Look at the next organism. In the next one also, I am seeing those tiny structures, but they've reduced. Don't you feel they've become a little lesser in number? They are there, but they are a little lesser in number. So when I talk about microconidia, they are there, but okay number. So what do I call it? I call it the next one, that is Microsporum. And finally, coming to the last one, the background has become clean. I don't see any tiny structures anywhere. So the microconidia have almost become negligible. This is what you call as the last one, that is Epidermophyton. So the first part of this is done. We are done with that. It is going to have max to least, TME, max to least. That was microconidia. What about the macroconidia? I'm going to act a little smart over here, and that is, I have actually made a mnemonic on my own name, and that is how I had learned it, and I will make you also learn it in that manner. What do I mean by that? When I talk about TME, TME is telegram, right? I told you telegram. And my Telegram channel is how I have learnt it. My Telegram channel is Preeti Sharma's channel. Okay, so TME, PSE. Why did I say PSC? Because if they ask you what is the shape of the macroconidia, the first one is going to have a pencil shape, the second one is going to have a spindle shape, and the third one is going to have a club shape. So repeating once again, when I say TME, you are going to learn it as PSC, pencil, spindle, club. Let's go ahead and look at the pictures once again. Now back to, again, as soon as you get a question on it, this is what you're supposed to write. You're going to remember my Telegram channel, and that is TMEPSC. What do I mean by that? So when I say T, we have pencil shaped. Can you see these big structures? Yeah, these big structures are coming across as pencil shaped only. So when I talk about the macroconidia, they are going to be pencil shaped. Let's look at the next one, the next picture. Again, as soon as I get a question, I write TMEPSC. So what do I see over here? The next organism, microsporum, because I'm going to see a spindle shaped structure over here. So remember, microsporum, the macroconidia is going to be spindle shaped. Coming on to the third one. The third one is in front of you. Again, I get a question. I write TMEPSC. So the third one is epidermophyton. So what is the shape that you're going to get of macroconidia? It is all club shaped. So this is the last one, that is club. So repeating once again, like I said, it's a smart mnemonic that I've made on my name and my channel, TMEPSC. So remember, pencil, spindle, and club shaped. Okay, having said that, now moving forward, now I hope this is definitely one of those questions which is going to come a lot in the papers, you will realize. Okay, moving forward, this is another diagrammatic representation putting everything in one place. So you will have trichophyton, microsporum, epidermophyton, that is you have T, M and E. Can you see the shapes written in front of it? Pencil, spindle, club. So means they have written P, S and C, exactly how we had studied it. It's written in all the textbooks like that. Okay, all said and done. Now I'm going to tell you a particular test which is very important, if you are targeting a little extra marks out there. And that is particularly done for hair. This is a hair perforation test. So what the sample that you're going to take from the patient is obviously going to be the hair, and you're going to incubate it with the fungus. Now, firstly, why do I want to do this test? Whenever I want to differentiate between two trichophytons, one is trichophyton rubrum and one is trichophyton mentagrophytes. So out of trichophyton rubrum and mentagrophytes, I took the hair and I incubated it with the fungus. So what will I see in case of rubrum and what will I see in case of mentagrophytes? So remember, in one of them I saw that the hair remained intact. What it was 2 weeks before, it is 2 weeks later, it's intact. In the next one, I saw that there were some perforations in the hair that were forming. There were some wedge-shaped perforations that were coming up in the hair. So when there is no perforation, means hair perforation test is negative. When there is perforation, this means hair perforation test is positive. So remember, rubrum gives you a negative test and mentagrophyte gives you a positive test. How do I learn that? So I've learned it in the form of a Hindi mnemonic actually. I hope all of you will be able to correlate with me on that. So remember, when I'm talking about mentagrophyte, phyte is farna. Farna means perforate, right? So phyte is going to perforate, or phyte farega. So phyte is farna. This means the perforation test is going to come positive in which one? In mentagrophytes. So remember, the men are going to fight and faro. So men fight a lot and then they tear each other apart. That is exactly how I've learned it. So mentagrophytes are going to show you the perforation test positive. There's another test which is going to give you that extra edge, and that is known as the ID reaction. When you go into the previous year papers, you're going to analyze this. That is known as the ID reaction. And what do you have in ID reaction? So this can usually, in most of the cases, this is seen because of fungal therapy, antifungal therapy. So you started giving some antifungal therapy to the patient as a part of his treatment, or because of whatever fungus he has. This was his first lesion. This was his primary lesion. But because of these extra, the fungus is releasing some products, or you started giving antifungal therapy, so the fungus broke and it started giving products. As a result, there were some satellite lesions which were formed away from the original lesions. That is known as the dermatophytids. When I say phytids, ID says that this is also known as ID reaction. So what is dermatophytids or what is ID reaction? Remember, it is nothing but that you are giving some antifungal therapy, or because of some fungal products from the main lesion, small chota lesions are forming around it. Dermatophytids or ID reaction. Okay, moving on. Now we obviously have to discuss the treatment part of it also. The treatment of tinea, I think everyone knows that we have to give as old topical. I think tinea is something which you might have seen around you also very commonly. Maybe your relatives, your friends, or you yourself have suffered from some fungal infection. So remember, first you have to have a combination combination. One is going to be a topical antifungal azole derivative. Second, you can have an oral drug also. Oral itraconazole or terbinafine is given. Terbinafine is these days being preferred. At least a minimum of 14 days course has to be given. Then it can go on to 2 to 3 months also, depending on the patient's condition. But terbinafine is better accepted in patients, so that is what is being given nowadays. But particularly for tinea capitis, patients who come to us with tinea capitis following seborrhea, following probably dandruff, that's the usual history that we get. Following dandruff or seborrhea, there's a case of tinea capitis that has occurred. So in those cases, oral griseofulvin is what is the drug of choice that is being said. But in most of the cases, the usual therapy which you should be knowing, because you'll be prescribing it to a lot of people, is you have to give some topical antifungals which are azole creams, and along with that either an oral itraconazole or what is preferred is an oral terbinafine. Okay, having said that, this is going to wrap up all of your superficial mycosis. Having discussed the superficial mycosis, let's go ahead and start our discussion with the subcutaneous mycosis. I hope all of you remember the mnemonic. Subcutaneous mycosis had MRCS. That is, let's do a quick recap. The first thing is going to be mycetoma. The next one is going to be rhinosporidiosis. The third one is going to be chromoblastomycosis, and the last one is going to be sporotrichosis. Now just a word over here, if you guys remember, sporotrichosis or Sporothrix schenki is coming in two places. It's coming in your subcutaneous mycosis also, and it's also coming in your dimorphic fungus, right? So I'll be teaching it to you all together in the dimorphic fungus. So primarily over here, I'm going to focus on the first three, and let's begin with the first one, and that is mycetoma. Now I hope as soon as I say mycetoma, there's a very famous image that should be coming to your mind. That is the very famous Madura foot, or there's going to be a foot that will be given to you in the paper. Along with that, there will be multiple discharging sinuses. Multiple discharging sinuses. So we have got a schematic diagrammatic representation where you can see there's some yellow or brown pus kind of a material that is coming out. Basically there's something to do with the discharge that is coming out. Well, having said that, the causes of this can be of two types. This same mycetoma or the foot that I showed you, it can either be because of something known as actinomycetoma, or it can be because of eumycetoma. And now I want all of you to learn basic alphabets. That is, when I'm talking about actinomycetoma, that is A followed by B. So that is because of a bacteria. There is a gram-positive bacteria which is responsible for it. Whereas when I say eumycetoma, after E comes F. So this is because of fungus. That is how we are going to learn it. So simple. After A comes B. So actinomycetoma is the bacterial cause of it. After E comes F. So fungus is going to be the cause of this. Now what organisms? Let's talk about that as well. When we are talking about examples, it's very simple to learn that actinomyces, when we say actino, the actino should have some word called actino in it. So actino, madura, madure will obviously be an actinomyces type. Other than that, there's a red color granule. Means what? Didn't I just show you that there are going to be discharging sinuses, and there are a lot of sinus pus kind of a material that comes out. So what is the color of the granules? The color of the granules that are coming out, that can also sometimes help me and give me a hint in identifying which organism am I dealing with. So please remember that when I'm talking or when I see red color granules, that is going to be Actinomadura peletriae. So remember, actino will tell me it's to do with actinomyces, and peletriae I'll give you a mnemonic in a while. Other than that, there are other bacteria which are going to be Nocardia, Streptomyces, Actinomadura. They can give you something like a yellowish discharge or a granule which is yellowish. So now what is now again going into a little bit of a mnemonic. I hope everyone knows yellow in Hindi is known as peela. Yellow is peela, right? So now but the irony of the story in microbiology is that whatever is seen is not what actually is there, right? So now peela is not peela. So when you're saying peletriae, it sounds like peela, but this is the one which is not peela, because that is how microbiology is. It's going to be a little tough. It's going to be a little different, opposite of what it actually should be. So peela is not peela. So peletriae actually is going to give you red color granules, and all the other bacteria that I've written, Nocardia, Streptomyces, all those are going to give me the peela, the yellow color granules. Now coming to the fungus part of it. When I talk about the fungus, obviously one of the most famous fungal organisms that we have is Madurella mycetes acetomatus. That is why it is very famously known as the Madura foot also. It is very famously known as the Madura foot also. Please remember, again, we can have some brown color granules, we can have some white color granules. You don't have to go into so much of detail, but yes, for example, Madurella exophylla. Exophylla is going to have brown color granules. Acremonium and Boydii, these are going to have white color granules. So yes, a little bit I think I have taught you when we were doing the initial part. Do you remember when we were studying about the starting, when I told you there are septate hyphae, some septate hyphae are going to be phioid or containing melanin, and that time I told you all the R things are going to have melanin. So Madurella is going to have melanin. Similarly, I had told you there is something called hyaline. Hyaline is not going to have any color. So anything with the Y sound as a U sound is going to come under it, like acremonium or Boydii. So all these Y and U ones are hyaline, which means it doesn't have a color, it's white. Whereas all the ones which are showing me melanin, all the AA ones. So if you remember, Madurella was one of them. So yes, exactly, it's not known, but again, like I said, if you know your starting and your basic of fungal chapter well, half your story or half your battle is won. Finally, if I ask you about the treatment, it's common sense, guys. When I'm talking about the treatment of actinomycetoma, as I told you, it's a bacteria. So when I'm talking about a bacteria, I'll be giving antibiotics. That's the best treatment. So what antibiotics am I going to be giving? There's a cotrimoxazole with or without amikacin. So cotrimoxazole is something you'll find written as a drug of choice everywhere, but some of the authors and clinicians believe that amikacin should be clubbed with it, and that is going to go on for quite a long time of at least 6 months. Whereas when I'm talking about eumycetoma, now eumycetoma is simply a fungus. For fungus, I can't give antibiotics. So surgical amputation or surgery is what is going to be advised when there is a Madura foot, or surgical resection is what is needed, right? So remember, for bacteria it's antibiotic, and for fungal it is resection. Well, with that, if I show you the gross picture, which I already have, it is the classical Madura foot with discharging sinuses. If I look at it under the microscope now, this is the first picture that I want to show you. So I saw that whatever pus, so I'll see, look at this patient once again, whatever pus you will get, whatever discharge you are going to get, you are going to collect it and look at it under the microscope. When I looked at it under the microscope, this is what I saw. What we notice in this slide is the very classical sun ray appearance. So let me zoom into it for you to be able to see the sun out here. As you will visualize, there are some purple color organisms which are radiating out. So as I told you guys, now when I say purple, if I say purple and I say this is something, although this is not a gram stain, this is actually an HNE picture that you have, but when we talk about gram stain, anything purple means gram positive. And what is going sun ray? This is the very famous actinomycetes. This is the very famous actinomycetes, which is a gram positive filamentous organism. I hope you all remember from your basics that you have studied. So gram positive filamentous organism, that is going to be actinomyces. And do you also notice, if I draw it once again, yes, you can see this classical sun ray appearance that is going on, but alongside, if you see the surrounding of it, you will see there is a pinkish color layer. See, all around there's a pink color layer surrounding it, here as well as here, right? So remember, this pink color layer is defined as the very famous Splendor-Hopley phenomenon. This is referred to as the Splendor-Hopley phenomenon. And please remember over here that there are a lot of theories given behind what is Splendor-Hopley phenomenon, but I'll tell you the one that is most accepted, and that is the antigen-antibody reaction. So please remember that we consider that actinomyces is an antigen, just like any other bacteria, virus, fungus. Every organism has an antigen, and if every organism has an antigen, you will make an antibody against it. So basically, it's the combination of this antigen and antibody that is happening over here. In other words, this pinkish layer is nothing but the famous antigen-antibody reaction. Okay, so now before I go on to the other picture, remember the Splendor-Hopley phenomenon is going to be coming twice when we talk about this fungus chapter. So Splendor-Hopley phenomenon, number one, is going to be seen in actinomyces, and second, it is also seen with an organism called Sporothrix schenki. I'll be teaching you Sporothrix schenki in a while, and that is exactly where you'll see this phenomenon once again. Okay, this was if it was a case of a bacteria. So imagine this is your Madura, this is your your mycetoma. This is your foot. You had a discharge. You picked up the discharge. You saw it under the microscope. It started looking like a bacteria. So your treatment goes in terms of a bacteria, like antibiotics. On the other hand, you had the same picture over here once again, and now when you look at it under the microscope, you see something like this. You see there is some organism and you can see a lot of brown color material. Now with the brown color material, what is coming to your mind? Brown color means something to do with melanin and everything with A. So this could be a case of Madurella exophylla. So that Madurella, which was having the melanin, this could be one of the fungal etiologies. And yes, if it's fungal, then obviously surgery is going to be something over antibiotics that I'll prefer. Having said that, coming back to the mnemonic, that is MRCS. This was the end of mycetoma. What other things are we going to study after that? R stands for rhinosporidiosis. Now, some of the authors believe that this should be studied here. Some believe that it should not be studied over here. Why? Because when I'm talking about rhinosporidiosis, the organism is Rhinosporidium seaberry. So now there is an update. They say that Rhinosporidium seaberry, sea should remind you of something like the ocean and the sea and the water. So they say that rather than calling it a fungus, you should classify it as an aquatic parasite or a protozoa. It should be classified as an aquatic protozoa. So please remember, because of the sea, you are going to put it up under aquatic. You're going to put it up under water. So many people don't even deal with it in the fungal chapter. But for a very long time, this was considered as a fungus, and that is the reason that I'm also going to teach you over here. But yeah, if they ask you the latest classification, you should know it's now considered as an aquatic parasite. All said and done. Now, as soon as I hear the word rhino, it's going to, remind me something to do with the nose. So what are the most common sites where you're going to see the infection? It's going to be the nasal cavity. But again, I'll show you a picture. There's a very classical photo for rhinosporidiosis that you have to see. Can you see this classical strawberry polyp that is coming out of the nasal cavity? That is how you define it. So as soon as they mention strawberry polyp, especially strawberry nasal polyp, the nasal word should remind you of rhino. So coming all the way back, one is nasal cavity, which is obviously going to be the most common, and I've told you the gross finding of it, it is going to look like a strawberry polyp. On the other hand, there are some rare sites. This can also occur in the genitals. This can also occur in the eyes. So please don't be misled if ever you see something like a genital or an eye history, but the picture is very classical. Don't feel it's not the nose, so it can't be rhino. Rhino can occur elsewhere also, right? Talking about the next, that is microscopic examination. Again, something that you can see over here. Can you see these big structures, which are the sporangia? And then you can see there are tiny structures inside it, which are known as the endospores. I can see the endospores which are sitting inside it, and exactly what I am going to visualize. So there'll be big sporangia, and inside you will have the spores. So here you have spores or endospores which are put up inside it. Next, you'll ask me the culture media, and that is where the trick in the story comes. This is non-cultivable, which is a question that has come so many times in the previous year papers. This is a non-cultivable organism. In fact, let me tell you, in the entire mycology, there will be two organisms that I will tell you which are non-cultivable. One of them is put up in front of you, that is rhinosporidiosis, and the other one is going to be Pneumocystis jirovecii or Pneumocystis carinii. So yes, Pneumocystis carinii also will have the same answer, that it cannot be grown on any culture media. Next, what is the treatment? If there's a polyp, like I told you in the beginning, that there's a strawberry nasal polyp, so you'll have to remove the polyp. So the ideal treatment is going to be a polypectomy. The best one that you're going to do is going to be a polypectomy. So that's your final flashcard that you have for rhinosporidiosis. Rhino should remind you that nose is the most common. Rhinosporidiosis is Rhinosporidium seaberry. So C should remind you that nowadays they are putting it under something to do with C, that is aquatic protozoa. Cannot be cultivated. Very important PYQ that you have. Apart from that, you can see the strawberry appearance, you can see the spores, sporangiospores, so that is very classical. Moving on to, remember, MR, mycetoma done, rhinosporidiosis done. The last one that we have is C. So C stands for what? Chromoblastomycosis. Now let me first tell you the image, and then I'll come down to the theory aspect. When I talk about chromoblastomycosis, there's another name given to chromoblastomycosis, and that is verrucous dermatitis. Chromoblastomycosis is referred to as verrucous dermatitis. And what do I have to know about it? Dermatitis tells me that there is going to be a skin involvement. I can see a foot picture that has been given. So please remember, this is because of traumatic inoculation. So you will ask me that why is the patient having this kind of trauma? So these are usually forest workers. And you know, why is the emphasis so much on forest workers? What is so different about forest workers than all of us? Because they tend to walk barefoot. So you will have the history of a forest worker. Most common question that comes, there's a forest worker who's walking barefoot, and because he's walking barefoot, there's a traumatic inoculation of the organism that has occurred. So I've understood why skin, because he's walking barefoot. But why verrucous? What do you understand by verrucous? Verrucous, verruca, what is that in dermatology? Verrucous refers to wart, right? So please remember, you see a warty cauliflower-like growth. You see a warty cauliflower-like growth which is right in front of you. You can see this warty cauliflower-like growth put up here. That is the reason you call it verrucous. So verrucous is also sorted, dermatitis is also sorted. What is the other name? Chromoblastomycosis. So yes, what is this chromo? Chromo means something to do with color, right? And I can see the color in front of me. What is the form that you're seeing over here under the microscope? We see the very famous copper penny bodies. The copper word is telling me that yes, there's a brownish color. That is why I called it chromo. So there is something called copper penny bodies, but I don't think the examiner is going to be that easy with you that he'll show you a copper color body and say that is this a copper penny body. He will tell you some other names. The other names are said to be sclerotic body. That's the next one that you have to know. Apart from that, we have something called the medullary body or the muriform body. So sclerotic body, medullary body, and muriform body, these are the ones that you need to know over here. And obviously copper is the only name which is looking sensible because it looks copper in color, but examiner is going to ask you the other names. So now most of it is done. Now let's come to the theory part of it, that okay, chromoblastomycosis was the name of the disease, right? But what is the name of the organism? So all the FFFs, because it's a forest worker, that is how I have learned it, because it's going to be something to do with the forest worker, then all the FO and F related things are the organisms that are going to come. So Fonsacia pedrosi, Fonsacia compacta, Exophylla, Phylophora, Cladophylophora. Can you see the abundance of the F forest worker coming across? That is how you learn. So chromoblastomycosis, which you see in the very famous forest workers, are going to be called, this was a recent question also that came in the paper. It is Fonsacia pedrosi, Fonsacia compacta, Exophylla, Phylophora, Cladophylophora. These are the FFF organisms. Root, I think I have already taught you, and you all know that how from a forest worker there's a traumatic barefoot history that will be always given to me. Apart from that, how are you going to do the treatment? Again, we have something known as amphotericin B, and we have 5-fluorocytosine. Forest and Fs are not going anywhere. So amphotericin B, 5 again an F, fluorocytosine again an F. Recently, they have also saying that only drugs alone cannot help. Firstly, they've introduced a new drug that is voriconazole. Voriconazole is another very important question that comes somewhere else in aspergillus that I will be teaching you in a while. But yeah, voriconazole is being treated or used for most of the disseminated and the severe infections. Apart from that, they are saying only medicine will not help, because at the end of the day, it's a very bulky cauliflower-like lesion, right? So you'll have to go in for maybe a surgery or a laser, or nowadays even cryotherapy is being tried. So basically some adjuvant therapy will be needed in order to decrease the bulk of this size also. Medicine alone may not be very useful here. Okay, talking about the last one, under the subcutaneous, I hope you remember you had MRCS, so mycetoma done, rhinosporidiosis done, chromoblastomycosis done. We are left with sporotrichosis, and like I told you, sporotrichosis is something that we will be dealing under the dimorphic fungus, because that is a separate and the next topic which is very, very important, right? So that primarily finishes off MRCS, which means that you are done with this and now you're ready for your summary. So when you are ready for your summary, this is what you have in front of you, and this is the summary of everything, starting from the superficial as well as the the subcutaneous, both of them together. So let's start with the summary tables, guys. Remember, these were a set of tinea that you studied. So the first one is what? You can see something on the cap, so that is going to be what? tinea capitis. But if that starts showing you flakes, if it starts showing you flakes and crust, that is known as tinea favus. And favus is something that was showing you crust, so you also called it scutula. If it becomes a boggy swelling, then we had started calling it carry-on. I hope you are quickly revising this with me. We've done all of this. Next, when you're talking about the trunk, when we are dealing with the trunk, obviously we have tinea corporis for the trunk is what we were using. But if you zoom in and if you see the next lesion is becoming all concentric. As soon as I start using the word concentric, the disease that comes to my mind is going to be tinea imbric, that is imbricata comes to our mind. Next one, as soon as I see the nail involvement is going to be tinea unguum. So that is something that is important. Unguum, ungual means nail. Okay, these teneas are done. What next? I have some pictures of the microscope which are going to help me. So the next one, remember these three dermatophytes and remember the selfish mnemonic that I told you that we were talking about TME, that is trichophyton, microsporum and epidermophyton. And what were we having? We were having P, S and C. What was P, S and C? P was what? We had the pencil-shaped macroconidia. Next, we have the spindle-shaped macroconidia. And lastly, we had the club-shaped macroconidia. That was the story of the macro. What is the story of the micro that you have to know? What was that going? That was going in the descending order, right? I hope everyone remembers this. We've discussed it in a lot of detail. Coming to the next one, you can see the foot. As soon as a foot is given to you, you are either going to think of actino, or you are going to think of the fungus, that is eumycetoma. But what is the picture given? If I ask you, what is the picture given over here? The sunray appearance. The sunray appearance was something that you saw for actinomyces, right? Next, coming to the classical nasal. As soon as I see nasal involvement, the rhino word comes to my mind. So this is a classical case of rhinosporidiosis. The rhinosporidiosis, the most famous question, can it be cultivated? No, there is no culture possible for this. Coming to the last one, I can see a foot, a forest worker, foot, all the FF, Fonsacia, forest worker, foot, amphotericin, all the FFF things coming, and the very famous copper penny bodies. So as soon as I see the copper penny bodies, I am talking about chromoblastomycosis. Chromoblastomycosis comes to our mind, and that is what sums up everything that you have studied in the superficial and the subcutaneous mycosis, with which you are ready for practicing a few questions. Let's begin. So first and foremost, you have a 28-year-old man who's presented with recent onset of rash that involved his upper arms. The patient was otherwise healthy with no known allergies, medications or chemical exposure. The physical examination revealed multiple hypopigmented, slightly scaly lesions on both arms. The culture was isolated, but the microbiologist could not get any results on a regular SDA media. There were no results on regular SDA media. Which of the following fungus is difficult to isolate on a regular SDA media? So I hope you remember that everything is a fungus over here and everything should be able to be, should be recognized on SDA. But when I'm talking about number one, hypopigmented lesions, the thing that was coming to my mind was Malassezia furfur. And if you guys remember, Malassezia furfur cannot be grown on a regular SDA because it had to show you the very, very famous fried egg. Remember, it had to show you that fried egg appearance. So for fried egg, you need olive oil. For frying the eggs, you will be needing olive oil. So SDA with olive oil is what you need. Why? Because Malassezia furfur was a lipophilic organism. I hope you were able to solve this question. One clinical hint given over here was hypopigmented. Coming on to the next question. Here you have another type of the same one. Here you have a young male, a 30-year-old male who's come to you with hypopigmented macules on the upper back. On examination of the skin scrapings with 10% KOH under the microscope, spaghetti and meatball appearance was seen. Now, as soon as I see the spaghetti and meatball appearance, I know I'm dealing with tinea versicolor, or in other words, I am dealing with Malassezia furfur. That is what is very, very important that you have to know. Okay, let's move on to another question. Let's go on to a very short question, but something that has come in the previous year papers too many times. What is the boggy swelling on the scalp? And actually, this is a dermat question. Boggy swelling. So, tinea capitis, carry-on, cruris, or Barbie. So, let's talk about Barbie. Is something that is going to involve the beard, right? Cruris is something that stands for the groin. Capitis means cap, that is on the scalp, but it's not boggy. When they ask me which is the boggy swelling is going to be again on the scalp only, but the boggy swelling on the scalp is the carrion. Having said that, moving on to the next question. Which of the following infects the hair, skin and the nails? So the trio is affected. When the trio is affected, it is, remember, many students will do this mistake. They've learned trio is something tri, but what tri? Tri was trichophyton. So when I talk about dermatophytes, it is trichophyton. It is not sporum. Where do you study trichosporum? Do you remember there was something called trichosporin bijli? Bijli is how you had learnt it, and I told you bijli is white, so this was causing that whitish thing, white piedra in the hair. So that was trichosporin bijli. Okay, over here the TME that you talk about, that is trichophyton, that infects all the hair, skin and nails. Let's practice one more question. I've got more questions because this is a very important topic. Moving on to the next question, I've got you a couple of extra questions out here because this is definitely one of the important topics that we have. Let's go and discuss this. All are true regarding dermatophytes except. All are true regarding dermatophytes except. So basically it's a true-false question. Let's start solving it. Are they differentiated on the basis of macroconidia? Of course, we had a very famous mnemonic. There is TME, PSC. So they are differentiated on the basis of the macroconidia. Does epidermophyton infect skin and nails? Skin, of course, and epidermophyton ended with N. So does it affect the nails? Yes. Microsporum has fusiform macroconidia. So I had told you TME, PSC. So trichophyton had pencil shaped. Microsporum had spindle. Spindle and fusiform means the same. So that is also true. Next, last one. Epidermophyton has abundant microconidia. See, when you're talking about microconidia, you had to basically go in a descending order. That trichophyton had maximum, then microsporum, and then epidermophyton. So epidermophyton doesn't have abundant microconidia. Epidermophyton has the least microconidia. So the wrong statement over here was option 4. You had to select that. Coming on to the next question. Which of the following is used for the cultivation of Rhinosporidium? I hope you remember I told you again and again, when I'm talking about Rhinosporidium, it cannot be cultivated. None of the above is going to be the answer. It is not cultivated. And please remember, what are the others written? SDA. SDA is for any fungus. I hope you all know by now. That is the chapter that we are reading. What is HeLa and Hep2? If you've heard the virology lectures, HeLa and Hep2 are cell lines. HeLa and Hep2 are cell lines which are used for growing the different viruses. But for Rhinosporidium, I don't need either because it cannot be grown at all. Coming on to the next question that we have. Here there is a 24-year-old South Indian patient with a history of taking bath in ponds and has presented with unrelated nasal polyps. The patient was admitted and a polyp biopsy was taken which showed spherules with endospores. I think everything is coming into place. All of the following are true about the diagnosis of the given patient except. So it's again a true and false question. Is the treatment removal of the polyp? Yes. Do you see spherules on biopsy? They've already mentioned spherules and endospores are seen. So that is correct. Is it a strawberry, a reddish colored, bleeding to touch polyp? Of course. Can it be cultured on Subaurout's dextrozagar? All throughout, if I'm talking about this disease, I'm talking about rhinosporidiosis. Can rhinosporidiosis be cultured on any of the culture media? No. So what is the answer? Can it be cultured on Subaurout's? No. So this was the wrong statement, or you can say the correct answer in this case. Moving on to the last question that we have in this category. There is an H&E stain of a nodular lesion of the arm of a forest worker that is shown in the figure. Which of the following is the key diagnosis? So when you see, firstly you see a forest worker. Secondly, you are going to see that there is a brown color body, and immediately what comes to your mind is a copper penny body. As soon as I say copper, the color is coming and your answer is in front of you. That is chromoblastomycosis. Actually, this is not the last question. It's pretty interesting. I've tried to include a bulk of questions so that most of them you can solve alongside me. So actually, let's practice one more question. Let's take this up as well. A patient presented with a swelling in his right foot with multiple discharging sinuses. Obviously, mycetoma has started ringing in your mind. The lesion did not respond to antibiotics. So I know that when I'm talking about a mycetoma, either they will be giving me a history related to a bacteria. If it would have been a bacteria, it would have responded to antibiotics. Here it did not. This means the cause is the other one, that is the fungus. So now if they ask me what is the likely agent, I have to pick up the fungus over here. Actinomadura is a bacteria. Nocardia is a bacteria. Sporothrix and Madurella mycetoma are fungus. But which of them is famous for causing mycetoma out of these is obviously going to be the Madurella mycetoma. So that is the answer that I will pick up over here. With that, we wrap up the superficial and the subcutaneous infections. And now what we move on to next is the deep or the systemic ones. So the first one that we will be covering under that is going to be the dimorphic fungus.